Hey everybody, Dr. Rob here. I'm here with superstar, expert in human evolution, longevity, performance, Dr. Eric Serrano.
Thank you, Rob. Welcome.
This is going to be fun. Are you comfortable?
I am comfortable. I'm on my grandpa chair, ready to talk to you.
Okay, well, let's dig in. I mean, you've been in it for a long period of time. You're a medical doctor. You treat a lot of athletes. The conversation piece amongst male athletes, but men my age, that middle age plus, is testosterone replacement. Where do you
Yes.
stand on that?
Well, I use a lot of testosterone now. I want to help those people out there that go to testosterone clinic. Do not just go to get testosterone level checked. That nothing works by itself. Testosterone works in combination with other things. I cannot understand how can a patient go to a testosterone clinic. All the other hormones are messed up, but they only put you on testosterone, or the iron levels are low, or whatever. So for me, in my clinic, I do extensive testing. For example, I check the PSA. I check a percent-free PSA that not even people are aware of it. For example, when you check your PSA, it gives you an absolute number, but that absolute number is meaningless without the percent-free PSA, which is the one that actually counts. You can have a level of 1 PSA, but if your percent-free PSA is only zero point 0.1, I'd be concerned about you and I repeat your levels later. Not that testosterone causes prostate cancer, actually protects you against prostate cancer, but be aware that when you go test, make sure that you check your PSA, but check your percent-free PSA, which is actually much more important than the total PSA. Now, I want a percent-free PSA over 20, okay? Depends on the number. I got people that have PSA of 18, but the percent-free PSA is 32. I do MRI of the prostate, it's normal. They have no cancer. And by changing the diets, by changing what I'm doing with them, vitamin D high levels, the PSA goes down to 4, which is crazy because they don't understand that. Now, when I'm doing checking for a person with testosterone, I have to ask a lot of questions because the first one is, what are you doing with your life? Are you sleeping? Are you eating correctly? Are you married? Because think about this. I have a quarterback in my office. Now I give him permission to make more passes because I put on testosterone, but the receiver, which is the wife, doesn't want to have sex. I make that person worse because now the marriage is going to have difficulties. They're going to have fights. I don't want to have sex. So I got to look at the whole round of a person. I look at the family member. I look at the economy. I look at the health. I look at the nutrition. I look at the faith and all those things involved in my decision on making testosterone. Now, be aware that if I have persons that are on that age that, hey, I want to get somebody pregnant, I don't know if I want to go on testosterone, but there's ways to go around that you can still use testosterone. For example, Jatenso is a prescription testosterone oral that allows you LH, FSH to be normal, depending on what dose you're taking, of course. The most common one is 237 twice a day. But if the person doesn't care to have children, I'm going to use testosterone. For me to explain when I'm going to use testosterone, I tell them, okay, if you live on LA, I can send you to LA in 3 different ways. I can send you walking, well, 4 ways. Walking, I can send you in a bike, I can send you in a Rolls Royce, or I can send you in an F-14. The walking is me putting you on those patches or little creams that the doctors tell you to use, like androgel or testing. That really doesn't do anything. That's only 5 milligrams of the drug. It's worthless. Now, the biking actually is a little bit more, it's a little better. It's the Troches or sublingual or the Striant or the Natesto. Now, the car is the cream. It's a Rolls Royce. It works great, but it's a compounded cream. It's higher levels than most people will write. So, for example, when you go get testing on Android, it's 1%. That does not do anything. It gets you levels up, but it doesn't get you to optimal levels. And I use 10%, 20%, depending on what dose I want to use with that person. Or I can use the shots. The only thing I have changed on the last 6 years, I don't use pellets anymore, Robert. Absolutely, the number of side effects, the number of complications for the pellets was crazy, especially in females. In men, testosterone pellets are okay, but then if they have acne, they have hair loss, they get angry sometimes, or they get impulsive, or they get hypersexual, I can stop it because they have the pellets on. I cannot make changes. I cannot say, hey, we can take you back off. You're the pellet. You're on it for 3 to 6 months. So I say, hell with this. I don't want to do that. In females, oh my God, that was a disaster. 20% of them come saying, oh my God, I feel like Supergirl. I feel amazing. This is amazing area. You're great. 80% feel like crap. Hypersexual, side effects, facial hair. It was crazy. So I went away. I haven't put a pellet. Well, I had somebody that was going on to Mount Everest, and I put the pellets on that person because I don't know if I'm going to see them again. So I put the pellets in there. But otherwise, I stay away from pellets. It's not good. I know there's a lot of people out there that put pellets on, but when you sit down and speak with the patient, to really ask them, how are you feeling, what are you doing, side effects. There was too many issues for me to deal with it.
So I'm gonna put the hold. I'm gonna pull you back a second. You gave a ton of great information.
Okay,
So let's back the truck up. PRT symptoms: fatigue, libido issues, lack of
but
muscle, sarcopenia. Correct?
that actually correct hyperinsulinemia. Absolutely.
What levels are you looking at? So if I come into you, I'm going to be 60 in 2 weeks.
What
Yeah.
levels would I order? I order total and free testosterone. I order a CBC, a B12 folate. I order a prostate, a PSA, a free PSA. I order zinc, copper levels. I want a 1-to-1 ratio. I order magnesium levels. I get a TSH, free T3, free T4, TPO antibodies. I want a vitamin D level, a B12 folate. I want an iron ferritin, iron profile. And then, depending on what I see, I might get an insulin or a glycomark. Most people don't know what a glycomark is. A glycomark tells me how up and down your sugars are, which I want to know because if your testosterone is good and your insulin levels and glycomark are messed up, maybe I need to work in something else, not your testosterone. So
So,
once I get that, I rarely order estradiol, by the way. I don't order that because it's a myth on the internet, but I would order some people that want it. But those are the tests that I would usually order in my office.
so you're basically ordering not just TRT, testosterone and free testosterone. You're holding a whole bunch of downstream stuff to see how the body's fully functioning before you
Absolutely.
prescribe testosterone, which is vastly different than many of my friends go in and say, "Oh, my total T is down." So he gave me stuff. Now
Yes,
you also told me something which makes sense because obviously if you're not detoxing, if you're toxic, if you've got too many free radicals, if you're too fat.
absolutely.
Hold,
Wait a second. I want to tell you a funny story. They say that, oh, testosterone causes heart attack. No. What happens is you get a guy in your office, right? And he's fat, out of shape, unmotivated. And his testosterone levels are low. And of course, I check his testosterone levels. I don't look at insulin. I don't look at anything else. I don't look at GGT. I don't do nothing else. And I put this guy on testosterone. Now this guy, oh my God, I want to go have sex. I'm going to go work out. I'm motivated. He goes out there and have a heart attack in the gym. Of course he did. It was not the testosterone, of course. It
good
was because he
story.
was out of shape and all fat and had cardiovascular disease, which you didn't check me for. When a person that is obese comes to my office, I do treat you different. I will sometimes order a calcium score to make sure that I have a baseline to see where you are. Because testosterone actually protects your heart. But if you have severe cardiovascular disease, it protects you still, but you're gonna go work out and it can become a risk for you to go have the heart attack. So I have to be careful. Nobody's the same in my office. Everybody's biochemically different, and I would treat each patient uniquely and different.
I love it. You want to personalize and individualize. So let me give you a scenario. I got a
Go ahead.
50-year-old man, right? Five
Okay.
foot 10, average height, 170 pounds.
Okay.
Lean, but 18 to 20% body fat. Not bad, but not optimized. And he says, you know what? The bedroom isn't as strong as it used to be. I'm a little tired. I'm a little moody. And all his numbers, blood sugar is 85. Everything works out where you're happy. His PSA isn't too high. What number range are you looking on testosterone?
Less depend if it's like you said, the age you talked about, less than 400. I'm going to look at it. Number one. Number two is the free levels less than 15. Absolutely. I would say, okay, yes. Now, I will ask this person, are you going to have children? Because I'm going to take a little different route then. If
Mhm.
that person still wants to have children, then I might go the Clomid side. I might go to the oral one, or I might go to the one that they keep the LHA, FSH normal, or I would give a dose that is lower than normal to keep the levels normal. But I would not, absolutely, I would use testosterone for that patient with all those symptoms. I will even use testosterone with a PSA of 6. I will use it. If I do a digital exam, I get a percent PSA free, and I might get an MRI if it's enlarged or whatever. It comes back normal testosterone. Now I want to explain. I want to explain the testosterone prostate issue. I want the people to understand.
Please, because
Okay,
here's the commonality. You increase your testosterone, your prostate grows and gets bigger.
okay. I'm going to talk back about Mexicans, about Puerto Ricans now. So be ready for that one, Robert.
Oh boy, I'm locked in and
So,
loaded.
so
Claro que sí.
okay. The number one risk factor for prostate cancer, of course, is age. The people that get old get prostate cancer. The
Mm.
people that get old also get breast cancer. Okay. Now, as you get older, your levels of hormones are coming down, not going up. So why are we getting cancer later? The first question is, what do the prostate do in your body? What is the action? What is the function of that prostate? Well, the prostate is supposed to be there to help you ejaculate, have the fluid to carry the sperm to where it's supposed to go. Now, here I am, when I'm younger, having sex, I want to have sex, I want to get somebody pregnant, I want to reproduce. As I get older, that is not there. So now I have a warehouse, which is the prostate, right? Sitting down with a bunch of Mexicans and Puerto Ricans smoking because I'm not having sex. I don't need to produce ejaculate. I don't have to carry my sperm. Then those people get toxic. Those cells change and become toxic because they don't have the testosterone that I needed to keep those guys busy so I can keep having sex. That's why most research in which involves sexual intercourse or having sex said that if you have sex less than 3 times a week, that will increase your risk of prostate cancer, which is absolutely true because you're not using it. It's an organ that you don't use. It's going to change. It was going to come numb. Now with testosterone now, which by the way, it does increases PSA. Let me explain it. Increases the volume of the prostate. Remember now, I'm going to start having sex. So the warehouse opens up. The builders start working again. I got to produce ejaculate. I'm going to increase a little bit of size. But that is not permanent. It increases on size. Now it shrinks again a little bit. And then the prostate goes back to normal. So be aware. Yes, testosterone increases PSA. No, it doesn't increase cancer risk. It's a total lie. Now, be aware that if you have a cancer and now you increase your prostate size, which no cancer part, and it goes up the PSA, you're gonna go, oh my God, I have cancer. That's what the percent free PSA is so important. The percent free PSA, if it's good, stays good. Prostate testosterone doesn't lower percent free PSA. It doesn't do anything to the percent free PSA. That's why that number is so important.
I think you gave clarity. That's in some really, really good examples. So you're okay with TRT for the selected population at the
Yes.
individual personalized right time. So tell me about the cream and the clear and all the stuff that they talk about, Barry Bonds, the injectable, the oral. Tell me all the differences. Not about Barry. I'm talking about for that 50-year-old, 170-pound, 5 foot
Okay,
man.
I will tell my patients actually, do you want to, and I'm going to explain, you want a plane, you want a car, a Rolls Royce, or you want a bicycle to get what you want to get.
Hmm.
All of them do work. It's how fast you want to get there, what you want to do. If you want performance and you want to go sky high, the shots work better than everything. I don't care what they tell you, it's a total lie. Shots are the best. Now you can use a V, which is every 6 month shot that works good too if you wanted to. People are not aware of that shot, but it exists. Okay, or you can use it once a week, or you can use subcutaneous every day, small dosages. I've been doing subcutaneous dosages for 11 years now, and I know they say they're making a big deal of it, and I'm going to explain why that is important. Or you can use, for me, for health, for normal prostate, for normal cholesterol, all that crap that they talk about, the cream, high dose cream is perfect. It does wonders for you. The 10% or the 20%, never go below 10% unless you want to do 5% for somebody that wants to still have LHFSH, still want to make sperm, then you can do 5%. It helps. But 10% and 20% is the best. Now, the injection is amazing. The two orals work very good. They have the LHFSH normalized levels. They don't completely whack them. So they're very good there. Now they have to be taken twice a day. The injections. Okay, let me explain what people say. Subcutaneous is better, blah, 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 all that stuff. I want to tell you what truly happens. If I give you one short high dose, what happens is your levels are going to go way up and they go to the side effect area because that one shot takes you way up higher. And you stay 2 or 3 days on that side effect area and they come down again, you feel good. So you get the acne, you get the hair loss, you get the little things that happen. Now, subcutaneous small dosages, they never go up to the side effect. They just stay high enough. You get in the what I would call in the performance stop muffin area without going to the side effect. So subcutaneous injections are very good. Now, do they work? I have people that use subcutaneous and they said they didn't work for me, so I have to do IM. The IM works better for me. I have people that do subcutaneous every day. I have people that do subcutaneous every other day. I have people that do subcutaneous every 3 days. So it depends on the population. It depends on the activity of that person. It depends on the nutrition of that person, and it depends on the disease state of that person. So you have somebody with diabetes, it's going to be different. You have somebody with cancer, it's going to be different. If I have somebody with cancer that is getting cachectic, is losing weight, I want to use the highest dose I can use of testosterone to be able to do it. I'm going to give you an example. I had a lady that had diabetes. This is crazy because you're going to say, oh my God, no way. This is a 79-year-old lady that is going to die. Her son is taking care of her, right? She's not eating, not getting out of bed. They have cameras in the room. She doesn't want to eat. So I said, listen, bring it over. She had a sugar of 400, right? With low potassium, low sodium, dehydrated. I put her on the hospital, give it IV, start controlling her sugar, right? She's still not active. So I told her son, I said, listen, I'm going to put on testosterone, which, go, what? Testosterone? Robert, within 2 weeks, this lady's getting out of bed, cooking, doing exercise in an exercise bike, feeling wonderful. But what happened? She's older. She goes to her doctor, geriatric doctor, right? I said, oh my God, your testosterone levels are 200 on a woman, right? Which is, on the woman, it's 70s is normal. Oh my God, that's too high. We want you off. I didn't know this. They take her off the testosterone. 3 weeks later, her son called me back. My mom is sleeping, not getting up. I said, what's going on? How her sugars are fine. They stopped the testosterone. I put her back on testosterone, and here is superwoman again. So testosterone can make a huge difference, but it depends on what kind of person, what kind of disease you have, what kind of symptoms you have. But it's not for everybody.
Two more questions on testosterone. You
Yes,
mentioned hair
sir.
loss. If I take TRT, am I going to lose my hair?
That depends on the number of CAG genes, CAG genes. Okay, people don't know that. There's a test that you can do. It's very expensive. I don't know who's doing it now. I used to keep on touch with that. I don't do it anymore. But if you have a CA gene, it tells you how good you're going to be in response to testosterone, how poor you're going to be. The people with the highest number of CAG genes have poor responders, and that's the people that are going to have hair loss and stuff like that. No, you don't have to have hair loss with testosterone. Now, the route does make a difference. If I use injectable, if you're going to lose hair, you're going to have a tendency to lose more hair. But if I use just the cream or the oral, you have less hair loss.
Outstanding. And the last thing is, you had told me, we spoke a couple of weeks ago about this, about cycling.
Yes,
And because one of the big complaints about TRT is once you go on, you have to stay on.
that is correct. Actually, you don't. We have seasons. We have fall, we have winter, we have summer, spring, all that stuff. I figured out, I have people that say, when I started testosterone, oh my God, Eric, I was ready to have sex. I had this high motivation. But at the end of 3 or 4 months, I felt good, but I didn't have it. Now, these are people that are using therapeutic dosages. Okay, Robert, I want to make sure to Silverman that I make a difference here. Therapeutic doses versus performance dosages. Okay, because there's people that are going to take 800, 1,000. The highest dose in my office that I saw was 7,000 milligrams a week, which is crazy, injectable. But if you want to be good with testosterone and be able to handle things and be able to do things, I start on sprints and I elevate the levels in a sprint. I get, hey, let's use your testosterone because the sun is going to start going out. You're going to start doing stuff in the summer. You're going to start doing, you want to take your shirt off now. Let's go. And I go from like, I would say from April all the way down to 4 months, April, May, June, and July. I put you on a level. Then what I do, I cycle you off for 6 weeks, believe it or not, and I restart you again. Why? Because the person feels actually very good. They say, I was retaining a little water, it went away. I had a little acne, it went away. I restart that person and say, oh my God, I feel good. My my motivation, everything went up. But now, again, Robert, it's kind of funny. This also depends on the person and the situation. For example, I had a patient I was going to take off, but I didn't because his father passed away. He was depressed. He was down. He didn't want to motivate. He didn't want to do anything. So I let that person, you need to stay on testosterone because you're eating poor, you're making poor selections. The testosterone will protect you. So it depends. I will cycle depending on what the person is doing, what the goals are, and what the situation is. But cycling is very important. Even with peptides, I will cycle. So yes, cycling is absolutely important. Even your testosterone goes up, you see your wife naked. If your football team wins, your testosterone goes up. If your football team loses, it goes down. If you see a people with a calf, and I want to have continued testing of the testosterone, it's like a radio station, up and down, up and down, up and down constantly. So the same way you have high levels, high levels, high levels, high levels all the time. No, that is no good either. You want to have great levels, but not super high all the time. And you want to have times that they drop a little bit, goes up and down, and that is the best way to do it, health-wise. Now, performance-wise, high dosages, no, I don't. That's totally different.
Now we're in this longevity, turning the page a little. We're in this longevity phase, the
Yes.
conversation of 2025. You and I both good. I know you love this term, so please don't lose your mind.
Well, I like longevity. For me, longevity is staying as active and as young as functional as I can. Doesn't matter your age. Now, do not believe. I don't care what clinic it is. Anti-aging, anti-aging,
Bingo.
anti-aging. You are gonna freaking get old. Every morning that you get up, you're a day older. I don't give a shit what you take. I can give you growth hormone. I can give you Ebu. I can give you hyperbarics. You are going to age. Nothing stops aging. Nothing. It's like a
Well, how
car.
about slows it down,
Oh,
attenuates it?
I like that word you use, slows it down. It won't slow it down, but it will prevent the breakdown to be quicker. That's different. So let me give you an example of a car. I can have a car that I give in tune-ups every 3 months. The car lasts you longer. True or false? And the car will function normally longer, but eventually the car is going to break down. It doesn't matter if you change the spark plugs. It doesn't matter if you change the oil. It doesn't matter what you do. The car is eventually going to break down. It has to. It's just the usage, okay? But to keep that car working at the optimal performance or your body optimal performance, then you can do that. It's not that it's going to anti-age you. You're going to still die. You're going to still die at the decent age, hopefully, but you're gonna die at the optimal level that you can. So if you were playing basketball at 30, you'll be able to play basketball at 70, 80. That's what testosterone, that's what hormones do. But you still look like an 80-year-old. You might look in shape, but you're still aging. So
So
no.
wait a minute. So I'm gonna go when I see Tom Cruise, I'm gonna say to
Yes,
him, Dr. Eric Serrano says, you are 63. You look 63. And he's gonna go and he's gonna give me that big smile and say, nobody thinks I'm 63.
of course they're going to say that because he's in shape, though. Now, he doesn't tell you that he works out.
Ah,
He doesn't tell you that he is good. He doesn't tell you all the other things that are there that the other people are not going to be doing. Tom Cruise is a great guy, by the way. Pretty sure, very nice guy. I see him. I used to see him at the Arnold, right? Very very nice guy to me. Talks to you. I mean, I don't know what they say about him, but I met him a few times. Very nice guy. Him and Rocky, amazing. But it's kind of funny because he works out hard. That dude is no joke. People see him in shape, but that's because he's functional. If I had to pick one drug, Robert, that completely prevents aging, that completely prevents all the side effects or anything, is the only research 100% of the time that will give you benefits is exercise. The other drugs, anything that gives you side effects. But people do not want to exercise. They want to sit down and watch TV. They want to sit down and listen to your phone. They want to sit down and do
how
nothing.
much exercise? Okay, here we
Oh,
are.
that's a great
How much
question.
exercise? What kind of exercise? How
Okay,
often?
let me go into two phases. I'm going to talk about strength and I'm going to talk about aerobic exercise. Most people think, oh, I got to run every day. Bullshit. The research shows, Harvard study, optimal number levels of exercise is 3 times a week. You live longer if you exercise 3 times a week. That's 111. If you exercise 4 times, you increase the benefits, but very minimal. Maybe 20% is it worth it for me to run. How many miles a week? Believe it or not, 12 miles a week. You don't need to do 50, 25. No, 12 miles a week will give you benefits for longevity. Let's use the word longevity here. Now, how fast you want to run? This is what is interesting. When you see people jogging, you see them jogging like this, right? No, that doesn't increase. That doesn't increase your chances of longevity. You want to run a pace about 3 to 4 miles an hour, which is okay. I mean, kind of like fast, but not too slow either. So you do not want to be out there walking or jogging. That doesn't give you the benefits. You have to really work at it. Now, cardiovascular, that's the cardiovascular component. For a strength training, which is totally different, I like strength training more than I like aerobics, by the way. But that's a personal, and also I'm kind of lazy. I hate doing aerobics, by the way. But strength training allows me to do everything that I do every day. Get my ass out of bed, from sitting to standing. I use my strength. Carrying grocery bags, I gotta use my strength. If I want to defend myself, if somebody attacks me, I gotta hold you. I gotta punch you. Strength training is the secret of long life. In the old days, we used to do this when there were no supermarkets, when there's nothing, and we have to survive. We go hunt. We use the speed. We gotta go catch the prey. Once we stab it, we have to fight it. We have to do it really hard, and then that lasted a couple of hours. We were done. We go back. We take our prey back to our cave. We sat there. We clean it. We sat down. We cooked it. We might put it on the ground and hang it to ferment it. But that's what we did. And then the next day we started again. It was no aerobics. It was none of that shit. It was people to do something really quick, kill that thing, get back to my home base because I don't want to get killed by somebody else. So for me, strength training is a bigger secret of longevity than everything else. People get
Okay, so
osteoporosis, people get weak muscles. You don't move your bones, you're gonna fall, you're gonna crack your hip, you're gonna die.
so strength training with cardio, strength training first. We know that because we don't want to remove
Absolutely.
our glycogen. And the studies did show that a moderate type of
Yes.
exercise was considerably more effective than intense and light exercise. I have so many of my friends, and they're 60. Yeah, man, I went to the gym and I busted my butt and I'm sweating and this and that. And I just look at them, I go, and then you're in a doctor's office, right? What does that tell you? So the
You know,
recovery isn't so good. So number one, longevity, muscle, exercise. Give me some other longevity hacks that people
okay,
should
wait a
look
second
into.
before I do that. For those people that go to trainers, the best trainer or the best strength coach is not the one that makes you stronger, but the one that fixes your weaknesses. Let me repeat what I'm going to say. It's
Mm,
not the one that makes you stronger, but the one that fixes your weaknesses. If you
excellent.
cannot get out of a chair and you do 100, you can do 400 pound of bench. That's not help you get out of the chair. Yeah, you got stronger, but you didn't get more functional. So again, the best trainer or the best strength coach is the one that fixes your weaknesses. Now, biohacking. What else besides working out? The number one is faith, praying. I cannot tell you what a difference it makes. How much
Mm.
a peace of mind. A person with a peace of mind don't get stressed. A person with a peace of mind don't think about bad things. Thinks about good things that make you last longer. A person that sits down and pray by itself in a quiet, kind place, believe on Jesus, always is going to do better than a person that doesn't. Spirituality. Actually, they did a research and compared cancer patients, the same cancer, the same blood test, same everything. Where were the two biggest things to increase longevity in those persons? Faith and support. No diet, no drugs, no nothing. Those were the two only things that actually predicted longevity on that patient. Support, think about this, having somebody there to take care of you. Now, longevity, having a great wife. Oh my God, that truly helps. Truly, truly helps. People don't understand that. Sleep, okay? That's number two. You got to go sleep. Or number three, after faith. Number four, you have to have a community of people with you. Tell me who you walk with, and I'll tell you who you are. If you are walking with people that are working out all they do is like look on the mirror, all they do is being on internet, you're gonna do the same. That's weak. No, hang yourself with people that are gonna work out. Hang yourself that have positive outlook on life. Hang yourself with people that go to church because you're gonna live longer. That is huge. If you spend more than 2 hours per week, 5 days, watching TV, that is a no-no. Okay, remember that. Do not do that. You can work out, listening to stuff, but make sure also be outside, spend time on the sun, be active, not inside of a building. Be outside all the time. It makes it. Love you too, honey. Be careful. Be aware of that. Make sure that you are active. Do not sit down and do nothing. Taking testosterone, taking hormones is not going to compare to the things that I just told you. Another little trick. I hate cold plunging. I hate it. I have a cold plunge. All my athletes have I have a hot tub and I have a big thing. I show it to you in a second right here, Robert. But I don't go in the cold plunge, but it's amazing what it does to people. With people with rheumatoid arthritis, I make people work out, put their hands on the cold plunge. You don't have to go inside the cold plunge, but I have tips and techniques. For example, if you work out your biceps, you go work out the biceps, you can put your hands under the water, and it makes a difference how you feel. It helps with your soreness. Those little things do make a massive, massive difference. So I hope I give you a few things that you can use to stay longer, better.
Well, I'm not a crazy on the cold plunge either. There's better things I could do than freeze my huevos.
Yeah, I agree
Cold
with you.
shower seems to be effective for the cold uh, shock protein, 50 to 59 degrees.
The study, I'm going to talk specifically on hormones here. You have to spend at least 3 minutes on the cold plunge to increase your testosterone levels. About the heat shock protein, yes, a cold shower, but it has to be, you have to spend there about I would say between 60 to 90 seconds on that cold shower to make a difference. It's not going in and running back and forth like I used to do.
No, no, they do
You have
that
to
just for
spend time on the
show.
cold shower.
Which supplements, over the counter supplements, vitamin store, not that you would ever buy a supplement in a vitamin store per se, which supplements would you recommend for health and
Okay.
longevity?
You know what? I have created my own supplement, but I'm not going to sell here. I want to keep it. I'm going to keep it straightforward. First of all, number one, everybody should take a multivitamin. Everybody. I mean, buy a great multivitamin. I know that people say, "Oh, I buy Centrum, I buy one a day." No, those are worthless.
Mm.
I have my own brand. It's called Core Essentials. It makes by Poliquin. Do you have to take mine? No, but mine give you the active, only the active forms. Plus, I have mushrooms, vegetable fruits in it.
You're
Why? Because
talking,
there's
when you
out
say
there
active,
stuff.
you're talking methylated.
Yes, I'm talking methylated or phosphorylated. So
Okay.
P5P. So be aware that those are active. Those are the right ones. Number two, an enzyme. Every single person should be an enzyme product. Why? They prevent cancer. They help with digestion. They prevent colon cancer. They help you absorb nutrition. You not what you eat, but what you absorb.
Mm.
Enzymes are absolutely a must every day with meals or empty stomach. You must have enzymes. Different enzymes.
Digestive
One,
enzyme, you mean?
yes,
Digestive enzyme.
digestive
Okay.
enzyme. Now, some with HCl and other without HCl. If you have ulcer, you have issues with holes in your stomach, then you can have it without the HCl. Now, be aware that if you take enzyme, you don't have bile on your enzymes. It's not a great enzyme. It's an okay enzyme. Always
Right.
add bile to it. Okay. Number three, fish oils, or I'm going to be more complicated than this. Fats, not fish oils. The reason I say fats is because they're fish oils. There's omega 3, there's omega 6, there's omega 9. All those are very, very important. Okay, so be aware of that. Don't just take fish oils. All of them put together. I have my own supplement. It's called Alpha Omega 3 because I have 7 different fats on it. Total supplement. And the reason I did that is I look at blood tests on humans, and based on those blood tests, that's when I came up with the formula. Initially, omega 6 is the most abundant in the dietary world. That's
Correct.
what people say. In actuality, it's monounsaturated fat. If you compare tuna, chicken, beef, you compare ribeye. The first fat is not saturated fat. It's not poly, it's monounsaturated fat. So my fish oil have oleic acid, omega 9, might have omega 3, have omega 7, might have CLA, might have GLA, might have MCT. I have all the fat that you require in one product. And the reason is because they have to be on balance.
Omega
Now,
7 plus omega 3 could be perceived as the perfect 10.
that is correct. Very good. But it's a necessary palmitoleic acid. It's necessary for the body. So that's why my fats, and I check bodies people's blood tests and the levels go up, they do perfect. Now, can you get other fish oils? If you're going to get fish oils, buy them with a dark bottle, cannot have any, absolutely no sunlight hitting them.
Correct.
The capsule also has to be dark because you take it out and put it in a plastic bag, you take it to the gym, and the sunlight hits it, and they become damaged. So make sure that they are dark also capsules. Just remember that, okay? And a non-sunlight container. Now, those are my number top 4. Now, I'm going to have free-form amino acids. Why free-form amino acid? In this day and age, everybody takes protein shakes, which 80% of the population taking protein shakes will get a freaking allergy to whatever they're consuming. The reason for that, Rob, is in nature, nothing has protein without fats. Let me repeat this. I want you people to understand.
This is
In
important.
nature, there's no proteins without fats. They go together. There's no protein without fats. Why? Because fats slow down the digestive system just enough so you can digest the proteins. Now, what in nature has protein without fats? That's an easy answer. Viruses, bacteria, and parasites. They're all protein with no fats. You don't want to have. It's that an easy answer.
You're so right about the protein because when you look at things, so obviously fish a little higher on the fat,
Yes.
lower on the protein scale. Bison, probably the leanest thing you could have,
Yes.
but they all do have fat. There is
Proteins
no
and fats. Nuts. Everything has to have proteins
egg
and
white.
fats.
Egg white is the only thing that's protein without fat, but it's not a complete protein
Well,
like you
wait a
said.
second. I've never seen a chicken shit an egg white. I'm sorry to tell you that.
No, no,
When you open the
I
egg,
got
I'm
you. I got you.
sorry. It comes with, you cannot say egg white because that is not true. It's an egg. Now, you separate it. I can separate the chicken fat from the chicken, but that's still, don't even go there, Dr. Silverman. You say egg white. No, that is not a true egg. That is egg white. I separate them, which is actually wrong because when you do that, you become allergic to eggs. And people buy egg whites all the time. You cannot do that. You have to have
Do
the
you
egg
think
yolk with the
they're
egg
do you
white.
think they're allergies or food sensitivities?
Oh my God. I have a lot of doctors and patients. This is a huge fight. Okay, let me be doctor correct here. Let me be doctor correct. Okay, food sensitivity because it's not an IgE response, which is, by the way, Dr. Silverman, I want to tell you this. Years ago, I started doing the pinprick test, right? Because the IgE on the skin, right? I did that because they were giving me $800 to do that test in the office. So I pin and prick. If you fire on my office, I did a pin prick on my office, right?
Hmm.
And I said, okay, I'm going to get this test and I'm going to see what happens. And then I did like 300 of those tests and I compared those tests to the patient. I said, are you having this? We eliminated the foods. Nothing happened. When I did the IgG or the food sensitivity, that's when I start getting true response to patients. So for those people there that I say, oh, I check my allergies. If you did a pinprick or IgE, absolutely forced. I prefer you to do an IgA, an IgG for true food allergies. Now, IgE for environmental allergies, yes. But I still will do, don't come to my office with an IgE because it doesn't tell me anything. All it tells me is anaphylactic reaction. That's the only thing. Otherwise, it doesn't show anything.
I'm happy you said it correctly. IgG, IgA, maybe IgM, secretory IgA,
Yes,
IgM.
maybe.
We
That's
got
right.
it. We are now doctor correct. I'm big on food sensitivities. You know, it's fascinating because I hear somebody say, wait a minute, you take the fat away, it slows down, the protein speeds up, and protein is a very involved process. But the other thing that it goes with it is now this protein may be being read differently at a different speed by the immune system,
Yes.
causing cross reactivity,
And
molecular mimicry. And
yes, that's
now
what
we've
happens.
opened the
And
Pandora's
eating that
box.
fat, Dr. Serrano, that's exactly correct right there. I'm taking all this whey, this casein. When I digest that food, now I don't have that fat there, and it goes really fast. I absorb pieces that are mimicking maybe a peptide from the E. coli, maybe a peptide from the parasite, maybe a peptide because those elements don't have fats on it. Now I consume that. Now be aware that it is important to always consume fats with proteins and fats together. That's what they were created together, and that's what they should
And
be
they're both
together.
essential.
And
They're
and
both
you know what?
essential.
And I have protein shakes. I have proteins that are protein shakes, but I tell my patients I make those to make pancakes, to mix it with butter, to do stuff like that. Never eat it by itself. Now,
Okay.
I want to explain something to do.
I'm going to
Now,
interrupt you before you go there. This is good. All right. Well, I have an answer for you.
go
I'm going to
ahead.
have a plant protein. I'm going to have a plant protein with leucine and use it as a signaler.
That is the most asinine, stupid. I mean, I, I hate vegetarians, by the way, but I have people that are vegetarians.
Don't hold
The,
back now. Don't hold back.
the vegetarians, there's no culture that ever lived that was vegetarian. They died. They don't have B12. They don't have iron. Vegetarians don't exist. I tell my vegetarians, okay, there's going to be a war, and the people on the war are going to completely blow away every single supermarket on the earth, right?
Mhm.
Now, we're in winter time. Where
We
in the
do.
fuck are you going to get your vegetables? You're going to die. You're going to put a tomato on the ground. It's not going to grow. You're going to die. You have to eat meat. You have to go hunt the food. Humans are not meant to be vegetarians. They don't exist. No
Okay, so you
culture.
don't like vegetarians. Only 3% of the population are vegetarians. How about vegans?
I,
Oh, here
I,
we go.
okay, vegans are people that swim in the same shit, but they smell different. Let me put it that way. And I know you're laughing at me. I'm sorry. That's the only way I can present it.
I
But
just don't know what to say to that.
but that is the way it works. Vegans, they're vegans. Okay, they're vegans that eat or an egg or a cheese.
Okay, all right. I got to stop you before you get us both shot.
Go ahead.
Carnivores. Are you okay with the carnivore diet?
I am absolutely a fan of the carnivore diet.
Well, that may
But
explain the opposite side being a vegan and a vegetarian.
yes, let me explain this. For me to decide which diet I'm going to use in any client, I never use the same diet with any different client. I have to know the disease state. Let me give you an example. Do I want to give a diabetic a high carbohydrate diet or a low carbohydrate diet? Do I want to give a cancer patient a high carbohydrate or low carbohydrate? Do I want to use vegetables?
Hmm.
Actually, if I have a patient with breast cancer, I would increase the vegetable intake of that patient, believe it or not. It depends on what disease state you are. If I have somebody with maple syrup syndrome, I gotta lower the protein. I cannot give them high levels of protein because they will have diseases. If I have somebody that actually I had 2 weeks ago, I had somebody with protein enterocolitis, unable to digest proteins at high levels. Those people I cannot put in a carnivore diet because they can't. I have to have enzyme. I have to have free form amino acids. I have to do things to those people to be able to absorb or digest the protein. If you have Crohn's or ulcerative colitis and I give you a high protein diet, I'm going to mess with you initially. I can't do that. I have to correct things first. So no, I believe on carnivore diet. I believe on ketogenic diet. I believe on low carb, high carb. It depends. For example, also an athlete. If I have a marathon runner, I use a high fat, but I use consume carbohydrates here and there. So my diet, I don't have a diet. I have a nutrition program, but it
Hmm.
depends on the person that they have and the disease state they have. Now, if I have somebody with severe depression, absolutely carnivore diet makes a massive difference after correcting other issues in there. Now the advantage of carnivore diet, it provides more nutrient pack for anything, and you eliminate the junk food that you're eating. You eliminate and you only are eating whole foods, which is huge on that department. But I do like some vegetables here and there. I like in season fruits
Okay.
because most people eat the same fruit over and over. No. If apples are in season, eat apples. If grapefruits are in season, avocados, cherries, strawberries, then you eat those. But then they're gone. Then you don't want to consume them anymore. Consume what's in season now.
Outstanding. It's funny. I have some people who want to get all the different polyphenols and the nutrients from fruits. They'll eat a different type of apple every day. Um, so you eat plants. You're okay with eating some plants. You just believe that the basis of your protein and your protein and fat should come from something that's walked on this earth. I get it.
Absolutely. You have essential amino acids and you have essential fatty acids. I don't remember having essential fiber bullshit. I don't remember essential carbohydrates, although they're essential up to a point, but it's kind of bullshit. That is a total, registered dietitian made up crap for you to buy their stuff.
So
Buy the cereal and buy all that crap.
The reason I was laughing is I said I need to put this disclaimer. These are not the thoughts of Dr. Robert Silverman. They are solely the thoughts and the opinion of
Just
Dr. Eric Serrano,
you can
as
say that. You
brilliant
can
as
say
he
that
is.
safely. You can say that very safely.
I
And you
just
know
did.
what? In my practice, Rob, I see every stage from children to grown-ups to adults to all people. I see people that have severe diseases, and I have people that just come to see me for sometimes to have a spiritual talk here and there, right? And it's pretty impressive what you can see and what difference you can make as a physician by
Mm,
listening. And I always tell
yes.
my patients go out there and say, "Oh, Eric Serrano made me feel better." Absolutely a lie, Dr. Silverman. I spend an hour with my patients. I only see cash patients. You have a block of an hour with my patient, okay? I only spend 1 hour with you. You spend 23 hours out there. I only give you guidelines. The other 23 hours, you're
Right.
there by yourself. I didn't make you better. I help you get better, but you're the person, you are yourself making yourself better. You're also making yourself sick. Don't come and tell me, oh, you made me sick. No, you're also making yourself sick, but you're also making yourself healthy. I gave you the guidelines and the step that you need to take to be able to do 23 hours out there. You spend that 1 hour with me. Yes, I can make a difference, but you're the one making the difference.
Well said. Well said. I agree. You put the wheels in motion, and hopefully the patient is compliant. And we have a greatest job in the world because we're able to help people acquire the most important asset in the world, and that's health,
And,
in my
and
opinion.
I have also a lot of chiropractors as patients, and that is a sign that is forgotten. I seen people manipulate. I'm not making this up because I want you to understand. Chiropractors. I have people with diabetes eating perfect, eating everything great, following what I'm asking you, and the sugar still high. A chiropractor goes and manipulate the neck or the lumbar area, thoracic area. They come back and the sugars are back to normal. So there's some kind of neurological component out there that I don't understand, that chiropractors understand, that can make absolutely a massive difference on that patient.
Well,
And
as
I want you to be aware of that. They do not know that, but it is real.
I appreciate you for purporting the positive benefits of chiropractic. There's something called the
Oh, it
autonomic
is
nervous
crazy.
system.
I try
Yeah.
everything, and the patient is doing everything. They get manipulated. A week later, the sugars are normal.
Listen,
Why
we're
is it?
having a conversation now, and it's pretty animated and pretty funny when you think about it. I already know what I'm going to call the title of the show, but
What are you gonna call this?
I can't. I got to be well behaved. I've been great for the last 2 years. Everybody said I've matured and acted great, so I don't want to get to the depths of inequity.
Go ahead.
In any case, it just shows that we're having a conversation and we don't agree on everything. That's fine, medical, chiropractic, but where we have the tie as healthcare practitioners is our goal is to keep up with the information and give
This
the best healthcare to who people we see in front
there's
of us.
always out there somebody that knows more than you do.
Well,
I
without
I
question.
always I always tell my patient two heads sings better than one. You might not like the doctor, you might not like the other person, but that person can help me make a decision. And many times that phone call, I call every single chiropractor I have if I send in a patient, I say, "Hey, I'm sending you this patient for this and this reason." I got four chiropractors I use all the time. One specialized on neck, one specialized on nutrition workouts. I have one guy that specializes on the head, which is incredible. You should interview this kid. He's a chiropractor, but with athletes and performance eyes, all that he's crazy. And speed, he's amazing. So I have four chiropractors that I use that will give me the service that I need. Now, are there good chiropractors and there bad chiropractors? Yeah,
Sure.
like there are good doctors and bad doctors, of course. But I'm telling you, a person that completely cuts out the other health doctors out there is a dumbass. I mean, oh my goodness, I've seen so many results with chiropractic care. I sit there and I say, no, you have a concussion and you haven't checked your neck and you haven't manipulated your neck. Run. I gotta send you because C1, C2, a little movement there can make
Mm.
the whole difference on the whole world. And if you don't go see that chiropractor, it's not gonna work. So yes, chiropractors are amazing help for us. I know that we consider them enemies. For me, they're my allies and they help me a lot.
Let's come to the conversation that everybody's talking about. The peptide that everybody's talking about. GLP-1.
Oh my God. I
Let's
was
go.
a, I was a huge writer of Ozempic. Okay. I used Victoza too. I don't know if you remember that drug.
Mm.
It's out of there now. But I was a huge writer because I was using it for my diabetic patients. Now, I had a few rules when I was doing it. I would write it for the patient. I explain the side effects, of course. I always start at the lowest dose. And if you were not dieting, I wouldn't give it to you. I have rules. I also said that I will only use it for 9 months. The reason I was using it for 9 months is because I rarely saw, and based on the literature, side effects with 9 months. Now, with the new, everybody buying over the counter, everybody going, on the last 3 months, I have two people with huge thyroid. I have people with paralysis of the intestines. I had, what else I have? I haven't had one with any eye problem. I did have somebody that had a liver inflammation. I rarely see that. Um, I have somebody with a GGT that quadruple. It was 7, and all of a sudden went to 300, and it was I didn't know she was taking Ozempic. I'm breaking my head in my mouth. Oh my God, what is this lady doing? When I called, I said, "Have you had any drugs?" Oh, I started using Ozempic. I stopped it, and the GGT went back to normal. So be aware that they are absolutely effective. Be aware that they make you lose weight, but a lot of muscle is gone. Be aware that they do have side effects. Initially, if you know what you're doing, they're minimal. As you up the dose, they're going to have more side effects. Be aware that you do not want to use it for more than 9 months. I wouldn't. For if you're using it for weight loss purposes. If you're diabetic, then it's a little different ball of wax. But be aware that they do have absolutely side effects. The longer you use it, you always want one side effect. It can be diarrhea, it can be nausea, it can be something, but there's always something there.
I've talked in this podcast a lot about the GLP-1s. Let's just say, I'll pose the question, what do you think of natural alternative ways to the GLP-1 for the
Okay.
average American?
Okay. That is a great question. This another thing that I use in my office. I use something called Cycloset. And I know you're not familiar with Cycloset. Cycloset is a medication, actually it's bromocriptine, it's the genetic name for it. It's a medication that being studied in people with high sugar levels in the morning. So, like sunrise, most people when they wake up, your sugar goes up because cortisol awakening response. Cortisol is released, so you wake up, so you have the sugar necessary. But they shouldn't go above 100. They should be 85, 95. They should be there. But some people go to 120s, 130s, so they say, oh, it's normal in the morning. No, that causes weight gain.
Right.
That means that your cortisol is off. That means you may be releasing too much cortisol. Maybe you're going up to bed late. Cycloset is a very safe, actually almost no side effect medication. It lowers your cortisol levels, it lowers your morning response, and also helps you lose weight. And it's very safe, but you have to take it every single day. Now, cycloset is 0.8 milligrams of bromocriptine. It has it's a different release factor because you can go buy bromocriptine, okay, but it's the same. Yes, it is, but the dosages are very minimal. It works amazing. It helps with weight loss. It helps lower your sugars. So that's one thing I will use. Number two, people talk about berberine and all that stuff. No, I haven't seen the results that I want to see with berberine. We're talking about sugar purposes and weight loss and compared GLP-1. There's a company called Celebi8 that came out with a GLP-1 agonist gummy. It is good. It helps too. Okay. Now, if your sugars are sky high, it will not do what it's supposed to do, but it helps you. And another thing is something called Humanafor. Now, this I know you never heard of this. Years ago, I had a guy contact me from California, Emery Delsek. He's a very famous bodybuilder, and he had an egg protein. It has to be fertilized egg. Couldn't be eggs. It has to be fertilized, and they separated this specific protein. They're peptides. There are over 8 different peptides. These peptides, I did the first study, but I don't have any economic association. I just know the product very well. I know the ingredients. I know everything about the product. I don't make any money. But it's the first thing ever, and I have done research with a lot of things. Taking 4 capsules of this Humanafor, I have 39 patients in my office. I check DHA, testosterone, cholesterol, GGT, IGF-1. I check every single marker that you can think of. And if your levels were low, that put it up to normal levels. If your lowers were high, like if you have high cholesterol, it lowered them. It lowered LDL. It was crazy how great this worked. It is not well known out there in the world, but Humanafort, and I will give you the phone number later, Robert, so you can talk to him.
Mm.
It is so good that I told this guy, I said, listen, I don't know what you have here, but this is amazing. You need to use it for patients. I have two patients that had cancer markers that were high, brought them down by accident. I didn't know that's going to do that. So I told this guy, I said, listen, I've used this for cancer. So he contacted vets, right? Because doctors would not do that. And they start using a gel or a cream on cancer of the dogs. And the cancer disappeared within 6 weeks. This is an amazing product. He hasn't done any publishing. I mean, he had published study, but he hasn't done any marketing, anything. He just sell it to people. It works amazing, Robert. Over the counter, it's oligopeptides. Amazing, amazing, amazing.
I'm a
It's a peptide that is
fan.
not discussed, but it's amazing.
All right. So I'm going to put you in a concise manner now. I want you
Okay.
as epigrammatic as you can be.
Okay.
My buddy listens to the podcast. He needs one thing to make himself better tomorrow. What are you going to give him? What are you going to suggest?
Ooh.
One. Solamente uno.
Pray for Jesus. Pray. Pray with Jesus. That is the most, I cannot tell you how powerful, or read the Bible every day. I cannot tell you the number of people that have cancer that are dying, that I send a text every morning. This has made my life better. And be in peace. Make sure that you do unto others what you want to do to you. I am, and lend a helping hand. Always, 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 always. I think those three things will help you survive. I want to ask something to this, because that is a great question. Money can buy you a watch, but no time. Money can buy you a book, but no knowledge. Money can buy you company, but no love. Money can buy you a house, but no home. Money can buy you a bed, but no sleep. And money can buy you medicine, but not health. Always remember that. Always try to spend as much time with your family members. I never had a patient that was going to die and told me, oh, I should have worked harder. I should spend more time with my wife. I should have spent more time with my kids. I should have done this. And it always comes back. I should have spend more time with family, or I should spend more time with God. Every single person that I ever have passed away have told me that. So that's my message for you today.
And we'll just close on that. Dr. Rob Silverman with the eccentric, rambling,
That was very good.
rhapsodic Dr. Eric Serrano.